JB asks, can a retina specialist tell when a total PVD has taken place naturally prior to surgery? I'm 55 and would be more comfortable waiting for a total PVD. At what age does a total PVD take place approximately? Well, JB, if you're 55, it could happen any day now. PVDs generally start around age 50, and with each decade, the prevalence, that means the percentage of people of that in that age group who have had a PVD, increases. So as my patient population gets older, more and more people would have had a PVD. By the time you're 70 to 80 years old, there's almost a 100% chance you've had a PVD. Some people get a PVD younger, those that have severe trauma, or those who have had who are very nearsighted, or those who have had cataract surgery. I would say at age 55, inducing a PVD in you would be very, very easy, because the adhesion or the stickiness of the stickiness of between the vitreous and the retina is much weaker than compared to a 20-year-old. So I wouldn't really have much concerns because inducing a PVD in you should be very, very easy. Oh, back to JB and the PVD. Email me if you want to some more information about a PVD, because I can send you an article about a PVD from my retinaeyedoctor.com site. DB, the day after surgery, is vision clear or is there blurriness for a few days? If a patient has infection, what are the immediate signs? Thank you for your presentation. DB, thanks for taking part of the webinar. Wouldn't it be cool if more doctors did this? Maybe I wouldn't like it, but what the heck. The day after surgery, vision is usually blurry, and it's blurry principally because you've had a patch on and you still have the effects of the dilating drops. I generally notice that vision improves to completely, quote unquote, normal within 3 to 4 days. The younger you are, the longer it takes. I have no idea why. That is to say, my older patients can sometimes, we take the patch off and vision is perfect, everything's clear. Younger patients seem to take over the weekend. Part of that, I think, is the effects on the drops. Older patients don't have the ability to focus near. The dilating drops cause blurriness because of our ability to focus. So this is especially noticeable in the young patients, meaning young patients can focus. One of the side effects of the dilating drops is to inhibit the ability to focus at near. So I think that's what's really bothersome to young patients, whereas older patients have already lost that ability to focus at near. If there were signs of infection, I always counsel patients to beware of two things. Vision that gets worse after the patch comes off, and pain that does not go away with Tylenol, Advil, or whatever you would normally take for a headache. So that means that the two biggest signs of infection are worsening vision and pain. Did the famous guy on YouTube have a 25 gauge, or was that older technology? His healing required about a month and he had some pain. Is that typical? So as a first thing I have to say about that video is it's really way too long. I've got such ADD that there is no way I'm going to be able to watch a video that's an hour long. I believe he had 20 gauge, and I believe he had some complications that he didn't quite understand, and that's why he went on this hour-long review of his experience with vitrectomy, because everything I've seen or heard about that video is just not expected. It is expected that when the patch comes off that you've got some blurry vision, which improves over the next 2 to 3 days. By day 3, your eye should be In most cases, vision is completely restored. There's no pain. There's never pain with any of this. Um, and the reason I lose so many patients to follow up, especially those who are out of town, is just because most of the time nothing happens. So I think the famous guy had something happen that he doesn't really understand, and that's what he couldn't really disclose or describe accurately, and it's causing the rest of us to be so hysterical, if you will. But so to answer your question, I don't think any of what he has to say was typical. AR, is there an increased risk of retinal detachment or other complications other than cataract 5 to 10 years down the road after having done the surgery? Now, I think your immediate risk is you're at higher risk for getting a retinal detachment probably in the first 3 to 6 months statistically. It's unlikely that you're going to get a retinal detachment if it hasn't occurred at that point. JD, he says, I don't have a question. Just wanted to thank you once again for helping me out a few years back. I saw your comment on Facebook last week that said you intended on attending, and I thank you for your support. I'm just so glad that I can share with this with others that you're about to um, finish up school because floaters are gone and floaters have stayed gone. And I guess I could ask your question. JD is, forgive me, I think you're still in your 20s, but I'm pretty sure you're one of those I've in whom I've operated, and you haven't had cataract surgery. And if you could confirm that later on, I'd love it. But thanks for staying in touch, and I'm glad you're doing so well. JB, do you know of any promising research being done in regard to floater removal other than vitrectomy? No, I don't. Mainly because it's a numbers thing. I think the present population, aging population, is faced with cures for macular degeneration, and that has a much bigger impact. There may be some theoretic use with Jetria, which is an injection, but the endophthalmitis rate is higher for an injection than it is for vitrectomy. So I think we have to be mindful of that. We always have to be mindful of safety. Um, AW asked the same thing. Thank you for answering my questions, Dr. Wong. Do you think there will be a safer alternative to treat floaters in the next 5 to 10 years, such as an enzyme or eye drops? So I'm going to say to you that right now, I think vitrectomy is probably the safest thing out there in terms of eye surgery or treatment. Um, the enzyme, like Jetria, involves an injection into the eye, and we put we inject patients' eyes all the time in the office for a variety of problems, and we always counsel that the eye injections have a 1 chance in 2,000 of causing an eye infection that would cause blindness. Compare that to 1 chance in 10,000 for a vitrectomy. Now, there are some other considerations, but in terms of just infection, that's something to consider. I don't think eye drops hold much promise. MB, I am 44 and had an orbital fracture and required surgery 12 years ago, which I recovered from completely. Does this increase the potential for vitrectomy difficulties? No. Vitrectomy is inside the eye. Your orbital fracture was in the surrounding structures, and it's just completely inconsequential. So you could have a vitrectomy knowing you've had a orbital fracture and not worry about it. AR, when do you think that an artificial vitreous replacement will be FDA approved? I don't think ever, because we don't need there is no need for an artificial vitreous. The vitreous is about 94% water. Once we remove the vitreous, that entire cavity or your entire eye is now 100% water, and we've been doing it this way for I guess about 40 years or 35 years. There just doesn't seem to be a need for a permanent artificial vitreous. JS, hi Randy, John here, taking a break from watching the Masters. Uh, I'm hoping to get to that soon too. I think it's going to be a wonderful finish. And for the record, I don't play golf. I just like to watch it. JH, my input on the pain, having multiple RD surgeries in the past couple of years, would be that it's probably induced by the antibiotic shot you described in the procedure. It's hard to know because you're comparing two completely different procedures. That being the retinal detachment surgery and vitrectomy. So I'm not real sure. John's view. Can you still hear me? Yep. All right. JS says he can't hear anything. I think I'm still audible. JS says, I have not had cataract surgery. I'm 27 years old and had FOV in 2011 and 2012 with Dr. Wong. John D. Thanks, JD. I appreciate it. JH, meaning that is the most painful part, and I usually feel the pain until later in the evening. Yeah, again, I don't know why that would be, because you should have had a retrobulbar block that provided anesthesia for hours and hours and hours. And again, I'm not familiar with your situation or how your doctor operated. So obviously there's a difference, but I'm not in a position to, be accurate with my answers because I don't know who we're dealing with or what exactly was done. DA, if you have cataracts, do you remove them at the same time as vitrectomy? I'm 59. No, I'd probably prefer you get the cataract surgery done before we have a vitrectomy. You can certainly have it be done after. There's no reason for you to have it done before, but you certainly wouldn't be doing it at the same time. AW, why do the chances of retinal detachment increase 3 to 6 months after an FOV? I thought a retinal detachment would more likely be during surgery, and are younger patients more at risk? I'm 31 and have had a retinal tear already in my left eye. No, I didn't mean to say that the chances of retinal detachment increase 3 to 6 months after the surgery. I meant you've got a higher risk of retinal detachment within the first 3 to 6 months of having surgery. So from the second you've had surgery for the next 3 to 6 months, that's where I'd be careful about retinal detachment. It doesn't increase 3 to 6 months later. I misspoke. I apologize for that. I thought retinal detachment would occur more likely during surgery. Actually, retinal detachment does not occur during surgery. Retinal detachment will occur usually a couple weeks after surgery, and that's because either there was a tear missed at the time of operation, or you developed a tear after the operation. But I've never seen a retina in this type of surgery detach during this type of procedure. And I don't think the fact that you've had a retinal tear would change my answers at all. AR, why other surgeons, people let hypotony go on for days? Why aren't there twice a day pressure checkups recommended? Would this be a way to catch hypotony really early? Yeah, and again, hypotony is not handled by all of us the same way. So I'm just not going to answer that question because I think it gets really complicated to the way different people practice. If I've got a case of hypotony, which is definitely due to the sclerotomies leaking, I just don't do anything. I generally don't worry about it and have not had to worry about it more than a day. MB, I've not had a PVD and worry about a detached retina during the process. Is there any way to predict the chances when you do the initial eval and assess the health of the retina? No, you basically have to go statistically based on your age. So the older you are, getting to the age of 50, the more likely you're going to be able to get, the more likely you'll develop a PVD. I'm going to say goodbye in just a few minutes because we've run over just a little bit. I think I got to everyone's questions. Obviously, if we didn't answer your questions, or you have another question that comes up as soon as we say goodbye, either sign up for the webinar Tuesday night, or you're always free to email me, or the best thing is to post your questions somewhere on the website so that we can share them with others. For all of you that attended today, thank you so much for letting me do this with you. if you'd like to, let's see each other again Tuesday night. Let's stay in touch over email or through the websites. And again, let me go back to give you my email. So here's my email. There's Chrissy's email. And MB says, thank you. You're welcome. Thank you. AR, thanks, Dr. Wong. Thank you, guys. Hey, enjoy the rest of the afternoon. Thanks so much for joining me. Stay in touch. Maybe see you Tuesday or maybe see you in the office. Chrissy, thanks for attending. I'll talk to you soon. Bye-bye, everyone.